but that is a form of red light therapy. It doesn't just use red light, it uses some near infrared light and a little bit of kind of a yellow light. But they shine that in the eye in intervals, and they do it for a few weeks, and then a few months you do it again. And for macular degeneration, they've been able to show that not only can the protein that builds up in the back of the eye in that condition diminish, but they can slow down the progression of macular degeneration. And for some people, even restore eyesight. They can actually help people see better.
Using red light therapy?
Using that form of red light therapy. So again, very early research right now. The challenge with all these at-home devices, whether it be for dry eye, whether it be for macular degeneration, there's, again, concern about the power density and about the potential change in temperature within the eye, because that could cause damage. There's also red light being utilized and investigated in Asia and in Australia for myopia for children. And so it's something that is really fascinating, and I am looking forward to as more information comes out. But I personally, from digging into it and trying to understand it, it does make me concerned of how I think there's just not as good a standardization or understanding of really how it works and which devices are safe and which ones are more medically something that you should see a medical provider for.
I read in the Nature publication that a 2022 study with 20 participants receiving red light therapy twice a week for 3 weeks found that they had improved tear reduction, and other dry eye symptoms compared to the placebo group. Tear reduction, what does that mean?
So dry eye, again, is an area where red light therapy is being utilized in right now. There's several studies on red light, on its benefits for dry eye. But the two areas where it's believed to help the most is in helping you produce more of your own natural tears, because the red light can shut down inflammation within the tissue and help you produce, basically it helps the cell more energized. The mitochondria within the cell can be activated by forms of red light, and nitric oxide is also produced, and then you have higher amounts of antioxidants. And so these cellular components in mice, and then now in humans, they're finding that tear production can be improved.
Which helps with dry eyes.
Which helps with dry eyes. But then also the red light can help with the meibomian glands in the eyelids. Your eyelids have about 25 to 30 glands, both the bottom and the top part of the eyelid.
Can you show me on that?
So it's actually in the eyelids. The eyelids would be...
Oh, in front.
They're in front, yeah.
Right.
So my top eyelids have about 30 meibomian glands in them, and my bottom eyelid has like 25 to 30. And every time you blink, these glands have to release a little bit of oil that prevents your tear film from evaporating. And so there's a lot of implications that go into this, but what happens is as we get older, age is a big factor. But then you also have more we can talk about with device use and the fact that when we're staring at devices, we don't blink as often, and we don't blink as completely when we're staring at a device. And so for that, along with diet and other inflammatory things, the glands stop producing oil as well. They become inflamed. The oils go from being a clear liquid to being a thick wax. They become yellow, they become cloudy, and they stop releasing oils into your tear film. And so with red light therapy, along with other therapies, but red light has been found to help with getting those oils to produce at least a little bit better. I think the research on red light and meibomian gland dysfunction is still in its infancy, but we have a different form of therapy called IPL, or intense pulsed light, which has been even FDA approved for meibomian gland dysfunction in treating dry eye.
Is there any research being done on red light and myopia, i.e. red light and short-sightedness?